Hello, and welcome back to another episode with me, Michelle Fortier, a licensed clinical social worker in the state of Florida. Today I'm going to be talking about how to choose a therapist. Now, first things first, for some people, your insurance more than anything else is going to dictate who you can and can't go to. However, if you have a large enough network and you have enough providers in your insurance, or you can go out of pocket, you can use these recommendations to really help you figure out what type of therapist might be right for you. If you go to a community mental health center or you go to a larger organization of therapists, oftentimes they're going to decide who you see, and that could be based on whether or not that person has openings on their caseload or if that person takes your insurance in that agency. So you might not get to choose who you see should you go to a community mental health center, or if you go to maybe like an outpatient clinic at a hospital or something along those lines. This can help you if you are choosing from all the different providers that are advertising on the internet. Now, the first thing I'm going to recommend that you do is talk to the people that you know. If you know somebody that has been in therapy and they have been, you've seen big changes that you're impressed by, or they say that their therapist has been very helpful, I can recommend getting a referral from your friend and see even what type of therapy that they're doing that has been so helpful. So even if you don't see that therapist, you can kind of narrow down what type of modality might be the best for you. Now, there's a difference between generalist therapist and specialist therapist. So for us in this practice, we are very much specialists. We have advanced training in DBT. We know that one in and out. We are trained in diagnosing personality disorders, in particular cluster B, and we have advanced training in treating cluster B personality disorders. Generalists generally have some idea about each diagnosis and some idea about modalities to use with each diagnosis. And this might be a little confusing. Specialists can generally act as generalists because we have the same background of knowing about all the different disorders and what type of modalities might be the most effective in treating them. However, a lot of specialists will refer out if there's something that they are not a specialist in and they think that you would benefit from a specialist. The hope is that when you go to a generalist and it exceeds their training and they feel that you need a specialist, that they have the wherewithal and the humility to refer you to a specialist. That's the hope anyway. Now, one of the things too that I can recommend is if you have symptoms that are bothering you, do searches online what those symptoms might be as a diagnosis. Take those little quizzes, figure out where you might be. And when you figure that out, that can narrow down how to choose people off of all the profiles that you see online. Now, the recommendation I have is don't be married to that diagnosis. Sometimes there are slight little differences between different diagnoses that specialists and generalists can parse out and figure out whether or not you fit that diagnosis, or another one that has very similar symptoms to might be more appropriate based on the way that you present or the way that your symptoms play out in the therapist's office. Now, how do you know the generalist from the specialist? You can look at the profiles online. So if you go to Psychology Today or Therapy Den or any of the other My Resource, you can look at if a therapist has every diagnosis checked off and has every modality checked off, that is a generalist. There is not enough time in your life to become a specialist in every modality and every diagnosis. It's just not possible. It takes too much time, energy, finances, everything to be a specialist or an expert in every diagnosis. Even the DSM-5, when you look at each different chapter of diagnoses, you're going to see that there were task force that were different for each group of diagnoses, because it's understood that experts are going to spend a lot of time and energy just really honing in on one diagnosis or a group of diagnoses. So that way they can really know the ins and outs, why that disorder exists, what are the symptoms, what are the differentials, when do you know that, what types of interventions to put in, when is a residential program recommended, all that stuff. They know that diagnosis inside and out. That is not to say that you might not want to start at a generalist. Sometimes a generalist is absolutely fine. Your problems are lower level, it can respond, because most generalists are really, they're trained very well, most of them, some of them, well, we'll see. So in cognitive behavioral therapy. And cognitive behavioral therapy can be really beneficial for a lot of different disorders like depression and anxiety, and it can be really effective to have just a generalist knowledge of different modalities to treat those disorders, or to be able to figure out when to refer. This is not a hard and fast rule. This is just something to think about and observe and see if it plays out for you. What I have noticed is most specialists do not offer free consultation. Generalists will generally offer free consultation to see if you're a good fit. Now, with specialists, most of us are going to want to do an intake assessment to really look at the clinical picture to figure out what's going on before saying, yes, you're appropriate for this practice, or no, you're not appropriate for this practice. And to do that, we're going to need to know your background. We're going to need to know what your history looks like, what your current symptoms are. And that's going to require a session. That's going to require at least 60 minutes plus consents and reviewing your history and completing a biopsychosocial. So for most specialists, and this is, like I said, not a hard and fast rule, for most specialists, we're not going to be offering free initial consultations. Most generalists, from my experience, will be. Now, with insurance companies, for providers that, so some specialists, they will accept insurance. Some specialists will not accept insurance. If it is somebody that is a specialist and accepts insurance, they can also practice as a generalist, and they should be willing to practice as a generalist if it is a referral from an insurance company, unless they really feel that you need a specialist, and then they will refer you back to your insurance company to find a specialist for your disorder. This is important. When you meet with your potential therapist, be wary of therapists who don't know what they don't know. And what I mean by that is some therapists, they perceive that they need to know the answer to everything, or they're going to look stupid or inept in front of their client. Competent therapists will be able to say, I don't know that. This is something I'm unfamiliar with. Let me learn a little bit more, and I'm going to get back to you. This shows humility. This also shows that you're not just getting smoke blown up your ass, and they're actually saying what they know instead of just guessing. If you see that, if the therapist says, I'm not sure, I'm going to get back to you, perceive that as that is a very competent and ethical therapist. We have to practice within our framework of what we know. And if you have somebody that isn't honest about what they do and don't know, I'm going to suggest stepping away from that therapist and finding one with more humility. My experience is you will get much better care. The next thing when meeting with your therapist, you want to find a therapist that is open and honest about your diagnosis. This is your care. I've run into therapists that will not disclose diagnoses. They will not disclose whether or not they diagnose somebody with a personality disorder. They have this perception, the client's going to be too fragile, they're going to react poorly. If they perceive that they're too fragile or they're going to react poorly, that is something that they need to work through and figure out how to manage, because people are entitled to know what they are diagnosed with. That's going to help them make decisions. It's going to help them formulate goals. It's going to help them figure out why they behave the way that they do. And like I said, our specialty is personality disorders. I have not had anyone yet react poorly when I tell them what their personality disorder is, why I diagnose them with a personality disorder, and what the appropriate treatment is. Every single one so far, I could run into one maybe today that they're like, nah, I can't believe you did that. So far, every single one has been thankful, because now they understand why they do the things that they do. They have a name for what they've been struggling with. They have the ability to find resources based on what they're struggling with. So I'm going to strongly recommend that you find a therapist that is comfortable talking about and saying why they formulated the diagnosis that they formulated and what their plan is to treat you. Now, there are some schools of thought that the relationship with the therapist is the most important thing for healing. All well and good, that might work for some people. It has been my experience that a good number of our clients that arrive here, they have had wonderful relationships with their past therapists, found them very caring and validating, and they really felt comfortable with them. They're here though, so their symptoms might have gotten a smidge better. Some of them have actually gotten worse with their old therapist they had such a great relationship with. So I am of the opinion that both the relationship and the modality are extremely important in treating at least some diagnoses. The thing is what we know is talk therapy isn't always considered the greatest for anxiety disorders. Sometimes just plain old talk therapy without a modality present can actually make anxiety worse. It can increase rumination. I have noticed especially with borderline personality disorders, very well-meaning therapists will keep those clients with them, even though those clients are not getting better, because they're afraid of that client harming themselves or, acting out if they refer them out. And so the therapist is walking on eggshells, the client is getting no better, and they're just stuck in this cycle. And over time, I've noticed and seen where the therapist starts getting very bitter and avoidant towards that person with borderline personality disorder, and then they don't want to work with them, and it becomes this really, really ugly thing. Therapists need to know, and especially generalists, need to know when that client exceeds their skills and needs a specialist. It is not just the relationship. From my perspective, what I have observed, the modality is just as important as the relationship. And my hope is that one day insurance companies stop seeing therapists as all generalists and start seeing us as specialists. And they also take into account that the relationship is just as important as the modality, and the modality is just as important as the relationship, that therapists are not interchangeable and modalities are not interchangeable. That's my hope for the insurance companies. On an aside note, there was just a great NPR article about insurance companies and mental health therapists. You can look that up. They don't treat us always the greatest. Anyway, now, if you meet with your therapist and your therapist says, you know what, your clinical picture is kind of cloudy, I can't really differentiate what is more prominent. Is it BPD? Is it ADHD? Maybe you're on the spectrum and haven't been diagnosed yet. Is there some other disorder going on? Sometimes there can be both BPD and bipolar disorder, and it can be difficult to parse out which is which if one is more predominant. And so, my opinion, a competent therapist will understand when the clinical picture is not clear and will have the humility and the ethics to refer you for psychological testing to get a clear picture. That's my opinion. Other people might have different ones. However, for me, that shows me that a therapist understands that sometimes pictures are not clear, It shows that they understand that there are people that are more appropriate, better trained, higher trained to parse out these differences by structured interviewing, by formal assessments, by formal testing. And that can really help narrow down the diagnosis. The therapist should be receiving back that report from the psychologist and reviewing that report from the psychologist with you to determine the best course of treatment. Now, the next thing is most modalities and interventions and what they mean can be found in therapist directories, like I said, like Psychology Today or Therapy Den or My Resource. You can usually click what each modality is and the best problems that it works for. The next thing is it is okay to leave a therapist if you don't see a benefit. However, there's a caveat to that. I would strongly suggest talking to the therapist before leaving. Sometimes the therapist can switch modalities or they can switch the way that they approach the problem. So being able to communicate clearly with the therapist is going to be of a huge benefit. So those are my tips and tricks about finding a therapist and keeping a therapist. If you have any questions or concerns, do not hesitate to leave them in the comment section and I will hopefully be able to get to them. Until next time, take care.